Hello there, welcome back to our channel. Today we're diving into a topic that affects many older adults, erectile dysfunction or ED. If you're experiencing ED, don't worry, there are ways to manage and treat it effectively. First off, let's talk about lifestyle changes. Simple habits can have a big impact. Eating a healthy diet, engaging in regular physical exercise, and losing weight if needed can all help. If you smoke, quitting can make a difference. Limiting or avoiding alcohol and improving your sleep habits are also key. And don't forget, managing underlying health conditions like high blood pressure or diabetes is crucial. Sometimes a lack of sexual desire can influence ED. A 2020 review found that over 80% of men aged 80 and above reported a lack of sexual desire. Seeking help from a sex therapist could improve sexual desire and reduce ED symptoms. Next, let's look at medications. Doctors can prescribe medications specifically for ED. One common class of these drugs is called phosphodiesterase 5 inhibitors or PDE5 inhibitors. These drugs work by relaxing and widening blood vessels, improving blood flow to the penis. Some examples include avanafil, known as Stendra, sildenafil, better known as Viagra, tadalafil or Cialis, and vardenafil, marketed as Levitra or Staxin. According to a 2017 review, PDE5 inhibitors are generally safe for older adults, even those with cardiovascular diseases. However, they're not suitable for people taking nitrates for heart conditions. Another treatment option is testosterone replacement therapy, or TRT. If low testosterone levels are a factor, a doctor might prescribe TRT, which involves administering testosterone via injections, gels, or skin patches. However, it's important to note that TRT won't address issues like reduced blood flow or nerve damage, so to sum it all up, older adults may experience higher rates of ED due to various factors, including medical issues and medications. A decline in testosterone levels can also contribute. If you're concerned about ED, it's essential to see your doctor. They can diagnose the cause and recommend the best treatment for you. Remember, treating ED often involves a combination of lifestyle changes and medical treatments. Discuss your options with your doctor to find the approach that works best for you. Thanks for watching. If you found this video helpful, give it a thumbs up and subscribe for more health tips. See you next time.